Hello, my name is Savannah and I'm a student from Los Angeles Southwest College. I would like to tell you a little bit about asthma. Asthma is a chronic disease of the lungs that causes inflammation and mucus buildup in the airways. This narrows the airways, making it difficult to breathe. There are often specific things that trigger the flaring of the airways. This includes exposures to allergens like pollen, dust, animal fur, respiratory illnesses such as the cold or flu, exercise, stress, smoke, and cold, dry air. Upon a diagnosis of asthma, priority is management and prevention of an asthma attack. When exposed to triggers, it can cause an asthma attack. An asthma attack, also known as an asthma exacerbation, occurs when the airways become even more inflamed than normal, limiting the ability to breathe. This is why it is important to avoid triggers. If your child has an asthma attack, at-home treatment can prevent a hospital visit. To manage asthma, medications such as albuterol and corticosteroids may be prescribed. These work to open or dilate the airways and reduce inflammation. The albuterol may also be termed the rescue or reliever inhaler to use when your child begins to show signs of having difficulty breathing. They are typically given as a metered dose inhaler, a dry powder inhaler, or a nebulizer. It is important that you and your child know how to properly use the prescribed inhaler for management and prevention of hospitalizations. I will be instructing you on the use of a metered dose inhaler, also known as an MDI. Step 1. Remove the cap from the mouthpiece of the inhaler. Shake the inhaler well 4 times or for 5 seconds. If this is your first time using this type of inhaler or it has not been used in a long time, you will need to prime it first by pressing down on the canister 3 to 4 times before use, the canister being the top piece of the inhaler. If you have a spacer, which is pictured here, insert the mouthpiece of the inhaler into the back piece of the spacer. Firmly hold the inhaler by placing your index finger at the top of the canister and your thumb at the base of the mouthpiece. Sit up straight. Completely exhale away from the inhaler. Place the mouthpiece of the inhaler or the spacer in your mouth between your teeth with the lips tightly closed around it. If the spacer has a mask at the end, make sure it covers the nose and mouth tightly. Press the inhaler and start breathing in at the same time, taking a slow, deep breath. Remove the inhaler and hold your breath for 10 seconds. Slowly exhale through your mouth or nose. If another dose is required, repeat steps 2 through 7 after 30 to 60 seconds. Recap the inhaler. So a few reminders. Rinse your mouth out after using the inhaler if the medication is a corticosteroid to prevent thrush. If the inhaler does not have a dose counter, write down each puff that your child has taken to keep track of when to refill the prescription. Check the expiration date before use. Store at room temperature and do not float the canister in water. Now I'm going to hand it over to my colleague, Kristine.
Hi guys, my name is Kristine and today I'm going to be demonstrating for you the correct way to use your dry powder inhaler or DPI. Firstly, let's talk a little bit about what a DPI is and what the benefits are of using one. A DPI is a small handheld device that delivers medication directly to your lungs in order to help you breathe easier. There are many different types of medications that can be delivered through the DPI to treat your asthma. One of the major benefits of using a DPI is that it's free from any propellants or harsh chemicals that may be harmful to the Earth's ozone layer. It's breath activated, which means that it relies on your inspiratory effort to administer the medicine down to your lungs. Another advantage is that the dry powder inhaler comes equipped with a dose indicator to make it easy for you to know how many doses you've used and how many you have left. When you get down to the red zone, it usually means that you have 5 or less doses, and this helps remind you when to get a prescription refill so that you don't run out. Now that you know you're a little bit more familiar with what the DPI is, I'll go ahead and walk you through the easy steps that you must follow to use it correctly. For the purposes of this video, I'll be using the Discus DPI, but keep in mind that steps may vary according to the specific brand of DPI that you're using. Also take note that unlike the metered dose inhaler that Savannah spoke about earlier, you do not need to shake this DPI before use. Okay, and the first step is to load the medication. To do this, all you need to do is to use your thumb to push the little thumb grip as far away from you as it'll go. Doing this will allow you to access a little lever that's hidden underneath. Next, push the lever away from you until you hear a small click. This means that you've loaded the dose of medicine for use. You will know that it worked because you will see that the doses available to you have decreased by 1. Step 2, you're ready to inhale the medication. To do this, you must first turn your head away from the device and exhale completely. Step 3, place the mouthpiece into your mouth and breathe in deeply. Your breath should be strong and steady so that it allows you to get enough medication down to your lungs completely. Be sure not to inhale too quickly though, because it will result in an insufficient amount of medication to the lungs. Next, you will hold your breath for about 5 to 10 seconds. Then take the DPI out of your mouth and exhale slowly through pursed lips and resume breathing as normal. Close the DPI with your thumb by sliding the thumb grip back towards you as far as possible. Make sure that you can no longer see the mouthpiece. Doing this causes the inhaler to reset and makes it ready for the next use. Be sure to follow the manufacturer's instructions about how long to wait between doses, because this may vary again depending on the brand of DPI that you're using. The last step is to rinse your mouth out completely with water. Inhalers such as the discus inhaler may contain a type of medication called a corticosteroid that is known to cause secondary fungal infections in the mouth if not rinsed out properly after each use. Now I'll go ahead and give you a couple of simple care instructions to follow when using a dry powder inhaler. So firstly, you want to make sure that you store your inhaler at room temperature and out of direct sunlight. Never submerge your inhaler in water. Remember never to shake your dry powder inhaler. And last but not least, keep all medications, including the inhaler, away and locked in a safe place. Now that we've gone over what a dry powder inhaler is, how to use it, and how to care for it, you are well equipped to tackle those breathing problems with confidence. I'll just go ahead and display for you what the dry powder inhaler looks like and some of the components that it has. So the mouthpiece is right here on the top, and that's where you'll actually be inhaling the medicine. And then there's also the little sliding lever, and that's the one that you will turn away from you and push back to you when you're done using it. And that's what loads the medication to be ready for use. And underneath where you see the little number, that is the dose counter, and that just keeps track of how many doses you used and how many you have left. And when it turns red, that's when you know that you're ready to go get your prescription refill. I also have another picture of what it looks like when it's closed. And now Christian will go ahead and talk to you a little bit about how to use the peak flow meter.
Thank you, Kristine. Hello, guys. My name is Kristine. I'm a nursing student at Los Angeles Southwest College. I'll be talking to you about the importance of peak flow and also demonstrating to you today how to use peak flow meter. A peak flow meter measures how fast and hard you can blow the air out of your lungs. It allows you to measure day-to-day changes in your breathing. Using a peak flow meter can help you track the control of your asthma over time, show how well your treatment is working, recognize signs of flare-ups before symptoms appear, and decide when to call your doctor or get emergency care. So I'm gonna go ahead and show you, the step-by-step how to use peak flow. This is the example of peak flow. So the first step is you move the marker to 0, but it depends on the type of peak flow that you're using. So this one is 60. So I'll move it to 60. Step 2, you stand or sit up straight. Stand or sit up straight with your chin slightly lifted and look straight ahead to keep the position of the entire time. Step 3, empty your lungs. Blow out and empty your lungs as much as possible. Step 4, breathe in. Breathe in deeply to completely fill your lungs with air. Step 5, put the mouthpiece between your lips. Put the mouthpiece between your teeth and close your lips tightly. Do not put your tongue on the mouthpiece. Step 6, blow out as hard as fast you can through the mouthpiece. The sliding marker will move up to the scale. Step 7, look at the meter. Look at the meter to see where the marker has stopped. Then step 8, you measure the peak flow 3 times. Step 8 is the last step. After that, then you record the highest number you reach. Be sure to reset the meter to 0 before each time that you blow into the meter. Keep a record of your peak flow number around the same time each day for 2 weeks while you are feeling well. The highest number is called your personal best peak flow. Thank you.
For more information regarding asthma and management, you can visit the websites from the Center for Disease Control and Prevention, or CDC, recommended resources: National Heart, Lung, and Blood Institute, Allergy and Asthma Network, and the American Academy of Allergy, Asthma, and Immunology. Thank you.